The following segment is sponsored by Northern Nevada Health System.
All right, we just got through 4th of July. Some kids might be having swimmer's ear issues, and Shelby Hunt is here. She is the Assistant Chief Nursing Officer with Northern Nevada Medical Center to talk to us about swimmer's ear. As a kid, Shelby, I seem to get this all the time, every single summer.
Were you a big swimmer?
I was a big swimmer, had a pool in the backyard growing up in Southern California.
Very common.
And a lot of people go to the lake. Is it just kids who get it?
Absolutely not. Anybody, what swimmer's ear is an infection in the outer part of your ear, so between your eardrum to your external ear canal. And it's when water pools in that canal and just starts collecting bacteria. So you even see it from kids swimming in chlorine pools, lakes, any of that, and it's that water that you kind of feel like you can't quite get out that pools and starts building up that bacteria and creating that irritation.
How long does that usually take to set in, from going in the water going in, to the bacteria taking effect to where it becomes painful?
That really is individual for every different person.
Okay.
Because you may not know that you have water in your ear versus others can feel it sloshing around. Usually it can be 24 hours to a couple days, again, depending on how you're swimming, how often you were swimming, where you were you swimming in dirty pool, dirty water?
I just remember going like this all the time, and I couldn't get it out. It was so frustrating. Then my neck hurt, but that was a whole separate issue. So what are some at-home remedies or treatments that we can do before we have to call you guys?
Biggest thing is just, try to dry your ears out. You can get over-the-counter drops at any pharmacy that are usually called, swimmer's ear, or
put
just
the drops.
dry drops in there. That can, help. Some people have even used hair dryers. Don't burn your skin, but a hair dryer to get just that warm flow of air circulating and trying to dry it out. We don't recommend putting cotton, Q-tips, things like that in your ear because we don't want you to possibly cause additional damage.
When do we know if we have to come see you?
If it's not going away with all the home remedies and it's really starting to hurt, especially when you start laying down, then you need to go be seen because you may need oral antibiotics or eardrop antibiotics.
Last question. When is it a chronic issue? I mean, when do we know it's a chronic thing? What can we do about that?
If it's just happening over and over again, you probably need to look at, knowing that you are a candidate or a person who just may be susceptible to that, getting those wax earplugs that you can put in, or other earplugs, or wearing a cap will definitely help. But if you generally are getting them frequently, you most likely will be getting them just routinely.
I had them. All right, Shelby, thanks so much.
My pleasure.
For more on swimmer's ear, go to mynews4.com.